Good morning to you all. It's been a little while since Stacy and I had come before you, and we just want to come back. I know a lot of people's excited. We're getting ready to see some things start opening back up, and I know our small businesses. We had a call with a lot of them. They're really struggling, and we're anxious to see some traffic start flowing so they can get back. And this time, I think just even more so maybe than previously that we start getting that traffic and these things opening back up. We just need to be more vigilant and really keep up the practices, I guess. And we'll let Stacy talk to a little bit about that.
Yeah, I just wanted to remind everybody about how important it is that we still continue our personal responsibilities in this and following the guidelines that's been put out. We've had to kind of pull back and stay healthy at home for a while, and it's been very necessary as far as a public health standpoint for us to learn more about the virus and things that we need to do, get our testing ramped up. When this first started, you couldn't find a test anywhere hardly, and now there's so many drive-through locations, and the health department here even is entering into a contract with Gravity Labs. So we hope to talk to all our healthcare providers next week about what that's going to look like for our county and providing them with more tests. So things like more testing is coming on to be able to allow us to have things reopen so that we can get back out. But it doesn't mean that the virus isn't here. So we just want people to remember that we still need to do things that are being recommended as far as the mask. That really will help. We need to make sure we look at all those minimum requirements. Businesses, even that have remained open through this, that are maybe banking, fast food, stores of that nature that have still been in operation, there are minimum requirements for healthy at work that we want to make sure everybody's aware of, that will just help us do this as safe as possible. One of those that's mentioned for all businesses is contact tracing, but businesses themselves won't be responsible for that. We just want people to know that that is a part of reopening, and the governor has helped us, and he's going to be hiring several hundred more people to spread around the state to help local health departments because we have been cutting funding in several years, and we don't have the capacity to do the kind of contact tracing it's going to take to safely reopen. So we have hundreds of people that will be helping us throughout the state. Some of those will come here on a local level so that we can get a hold of people, and businesses will just need your help if we do identify a case. Isolating cases and their contacts is going to be key in moving forward so that we can stop the spread of the virus as much as possible. So just want people to keep some of those things in mind. Also check the powcovid.com website because there will be some business resources on there very soon. So we want to be able to help you with cleaning recommendations, vendors that you may be able to use for PPE and hand sanitizer. We just want to be a resource so that Powell County can open as safe as possible. And we really appreciate all your patience and your help so far, and just ask that you stick with us and stay motivated so that we can move forward in a healthy way.
One thing I was going to touch on, Stacy, probably a little different for Powell County economy than some of the others is as we come online, we kind of talked about it in some of our meetings earlier this week. Not only, I think most of our people, we've been very fortunate they've adhered to the guidance, and you go to some of our drive-through restaurants, they've already taken protocols beyond what was recommended as far as masking ahead of time stuff. I think what's unique here as we start opening up, we'll start to see an influx of people from all across the country. I mean, even international at some point very soon again. But so it's not even so much what we do. We've got to be able to protect ourselves from those because a lot of those areas they come from haven't had the guidelines we've had, and so that's going to bring, I mean, like I said, as far as the social distancing, the mask, they're not going to be familiar with that. So we've got, I guess, a somewhat uneducated population that we'll have to be protecting ourselves from too. So that's something that'll be a little unique to us, I think. On the testing, is it going to be similar? Will it be like where they potentially set up like for a 2 week period here, or far enough down that road to be able to answer to that yet?
It's going to be handed over to the health department. So we're going to be able to order a certain number of tests per week for the county. So we want to get with all our providers and see how do we want that to look for our county? Do we want to spread them equally? Do we want to maybe set up a drive-through and funnel it toward maybe one or two places more than others? So it's just something we want to talk to them about to see what we can do. But definitely the number of tests that we're going to be able to get, no matter how we do it, it's going to help the county.
Yeah, I think, and that's one thing I think I'm excited to start seeing stuff reopening. I know our business owners are, and naturally our economy is very derivative off of that traffic, and our trail's been opening. And I think the time that's been afforded, and I agree, we've got to the point where we've got to start coming back online, but I think you've really talked to it in the past. This month, 6 weeks has allowed, like I said, the testing capacity. I think even though we still don't know everything about it, there's a lot more knowledge just about the COVID-19 virus in general. So even though I can see the steps that's happened in that time, that makes it a lot more feasible now that we can start coming back online with a lot of our stuff. So
we've definitely saved lives in the process. I know there's a lot of controversy about that, but that's the way it goes with public health sometimes. What we do saves lives behind the scenes, and it's hard to really see that, but just know the evidence that we have and the things that we've done, and it's really been a team effort. Everybody's come together and done well for our county.
I appreciate it. And like I said, we're real excited about the announcements of things, and I think here locally we'll start seeing a lot more of our normal activity come back to some degree, just be a little different in how we do it. So we're very excited to get back and get to start enjoying the beautiful scenery and things we have to take advantage of here. You have anything else, Stacy, you'd like to add?
Nope, just stick with us and just follow this page and the health department page for updates, and we really appreciate everybody.
Thank you all.